If you've tried to get a COVID test lately, you know it can be difficult. Demand is high, and the results can take a few days. Rapid testing can offer results in 10 minutes, but aren't as reliable. But what if you could take the test at home or at work? NBC10's Rosemary explains how a local healthcare service is helping make that happen for small businesses so they can stay open and stay afloat.
For nurse practitioner Caitlin Calamer, gearing up for work these days takes her inside her patients' homes.
I'm Caitlin from Vitable Health.
Calamer is the clinical director of Vitable Health, a local concierge healthcare provider that offers all kinds of services, including rapid COVID testing.
Many of our members are business owners, and so their test results are essential to them staying open.
Barbara Chavou-Pennock of Elkins Park relies on it. She owns Somerset Academy Early Learning Center near 8th Street and Girard Avenue in Philadelphia. She pays $55 per employee each month and $10 per child each month to have Vitable services like flu shots, physicals, and rapid COVID testing on speed dial.
Our staff are essential, and they are taking great sacrifices, making great sacrifices and risk to their own health and safety to come and provide care for our children and families every day.
We saw our membership exponentially grow over the last 9 months as we've been able to provide value to the communities that we operate in across Philadelphia and the surrounding suburbs.
Joseph Katanga, who started the Delaware County-based Vitable Health, tells me businesses like his are taking off in this pandemic as the need for testing is great. At Somerset Academy, peace of mind is the priority.
To be able to offer that type of service to our parents, again, it's worth its weight in gold.
That was NBC10's Rosemary. She talked to the founder of Vitable Health for more in-depth information about how his company can provide a lifeline for businesses in our area.
Joseph Katanga, founder of Vitable Health, thank you so much for being with us. Really appreciate it. I want to start with how you came up with this concierge healthcare business to begin with. You started a few years back, right?
Right, exactly. And the inspiration really was, so I moved to the Philadelphia area when I was 13 with my immediate family from Kenya. And my parents, chasing the American dream, started a small business, home health company. And, they had this workforce of $10 per hour employees where I'm sure many of your viewers would know that they make too much to qualify for the state-sponsored Medicaid plan, but too little to afford comprehensive health insurance. And so you'd find them overutilizing the emergency rooms where the average visit cost is $1,300, which was more than their average monthly salary. So they'd go into debt to pay off that ER visit cost, and it would just generally make upward mobility very difficult for them. And another factor that made it quite interesting, which where 70% of ER visits are unnecessary and can be taken care of at less expensive acute care options. And so the idea for Vitable was really, could we provide a less expensive way to get healthcare, the most frequently needed healthcare, to this population that's been underserved and ignored. And instead of having physical location, we bring the care directly to you, where because of that cost savings, we're able to drive down the cost of providing the care. And that's what really is catapulted our growth over the last few months.
And also, people have a new need, testing. It's been very difficult, as we know, especially around the holidays, to get tested. And that's something that your company provides, whether it's to an individual patient or in their home, or even to small businesses. If you're looking for rapid testing, your business provides that.
We work with a variety of daycares, car dealerships, and other types of small businesses, restaurants that have been really hard hit over the last few months. And we enable them through our network of providers to test their employees whenever they'd like. And an example would be one facility that we worked with randomly tested some of their employees, and they found, unbeknownst to them, that one of their employees was actually ill and it did have COVID. But we were able to catch it much sooner than if they'd gotten a PCR test, which would have taken several days to come back while the employee is still interacting with students or with other employees and customers. And so we've seen real value, or we've been able to provide value to the communities we operate in, and it's something that's continuing to grow throughout the Philadelphia and surrounding suburbs that we serve.
And I just want to point this out real quickly. I mean, you say it's affordable. The example we had from the daycare we spoke to that uses your services, $50 per employee, $10 per student, to have that service literally at their fingertips, to give you a call and say, hey, we need you to come in either to help us out with physicals or other kind of minor procedures, or to do the rapid COVID testing.
Right, exactly. You know, generally there's a disconnect between the best cost, best quality healthcare being reserved to high-income workers. But what we've done with our care delivery model is that we've made high-quality concierge-level care affordable to everyday people. And so, what's interesting is that we have our members that are hourly workers, the backbone of the economy, utilizing our services, getting the same concierge-level experience that higher income families that are also Vitable members get access to. And it's the same level of care, but and for us, it's really the care delivery model and our business model that enables us to provide it, as opposed to having a compromise in the care that we provide.
Joseph Katanga, the founder of Vitable Health, based in Delaware County, local company. We appreciate you taking the time to talk to us.
Thank you for having me.